Hi there, and welcome. Today, we're going to chat about something called chronic mesenteric ischemia. We'll break down what it is, what signs to look for, and some simple steps you can take on your health journey.
Before we start, please remember that this explainer is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always talk to your doctor or a qualified healthcare provider with any questions you may have about your health.
Okay, with that important note out of the way, let's dive in. This isn't just about a bunch of confusing medical words. It's really about getting to know your own body a little better so you can feel empowered. We're going to explore how your blood flow works and what we can do to help keep it moving just right.
So let's start with a big question, right? What in the world is mesenteric ischemia? We're going to take a really simple look at it, focusing on the blood flow that goes to your gut.
I know that name sounds a little complicated, but the idea behind it is actually pretty simple. Mesenteric ischemia is just a condition where your intestines aren't getting quite enough blood to do their job properly. And that word, ischemia, it's just a fancy way of saying not enough blood. That's all it is.
So how does your gut get all the blood it needs? Well, think of it like a city's road system. Your body has three main arteries that are like super highways, bringing blood directly to your intestines. But what's really cool is that your body has built-in backup routes. These arteries are all connected, so they can help each other out if one gets a little blocked.
And you know, this backup system is pretty amazing. It's actually the reason you might not feel any symptoms for a long time. Your body is just so good at finding detours that you might not notice a problem until at least two of those three main arteries have become narrowed.
Okay, so if our body has these great backup routes, what causes the traffic jam in the first place? Why does that blood flow start to slow down? Let's get into the main reason this happens.
Well, the main culprit, in most cases, is something called atherosclerosis. You've probably heard of it as hardening of the arteries, and honestly, that's a really good way to picture it. It's just a buildup of a sticky stuff called plaque inside your arteries.
Let's make this super clear. On one hand, you have a healthy artery. Think of it like a brand new, clean pipe. Blood just flows right through, no problem. But on the other hand, when that plaque builds up, the artery gets all narrow. It's just like rust clogging up an old pipe, which makes it really hard for blood to get through.
And this isn't just a small factor. This plaque buildup is huge. In fact, atherosclerosis is the reason behind more than 9 out of 10 cases of chronic mesenteric ischemia, so it's almost always the cause.
Okay, so what should you be looking out for? This part is all about listening to your body. It's pretty good at telling us when something's up. If any of this sounds familiar, it's a really good idea to talk about it with your doctor.
When this condition is chronic, meaning it's been developing over time, there's a classic trio of signs people often notice. First up is pain after you eat, usually about 30 to 60 minutes after a meal. Then there's weight loss, which, makes sense because eating has become uncomfortable. And this all leads to the third sign, a real fear of food, where you might even start skipping meals to avoid that pain.
There's a term for this feeling that really helps it make sense: intestinal angina. You might have heard of angina in the heart, right? It's the same basic idea. When you eat, your intestines need more blood and oxygen to digest the food. If they can't get enough, it hurts, just like the heart muscle hurts when it doesn't get enough oxygen.
Okay, so we've talked about what it is and why it happens. Now for the most important part. What can you do? This is where you can take back some control and really help manage your health. Let's walk through 3 simple steps you can take.
All right, here are 3 really positive steps you can take. First, try switching to smaller, more frequent meals during the day. This is less work for your intestines, which can make things a lot easier and less painful. Second, and this one is so important, is to work on quitting smoking. It's one of the best things you can do to slow down that plaque buildup. And number 3, focus on managing your overall heart health.
So when we say manage your heart health, what does that actually mean? Well, it's a few key things. It means keeping your blood pressure under control, managing your cholesterol levels, making sure your diabetes is in check if you have it, and of course, taking your medications just like your doctor prescribed them. It's all part of the same puzzle.
Look, just by listening to this and taking the time to understand what's going on in your body, that's a huge, powerful first step toward feeling better. And I really want you to remember, you are not in this alone. Your healthcare team is right there with you. So, before we finish up, I want to leave you with a little thought. Just a simple question to ask yourself. What is one healthy choice you can make for yourself today? It can be something small. Every little step you take is a win. Thanks so much for listening.